can see, today I will be discussing a review of Silver Diamine Fluoride as a treatment option in the primary dentition. That's quite a mouthful, and so we're going to be able to talk through what each of those words are addressing as we move forward. So this is a picture right here of actually the treatment, what the treatment looks like. As you can see here, there's these teeth that clearly have issues, cavities. You can see the decay here. And when you add the Silver Diamine Fluoride, that is what it looks like. Doesn't look much better, does it? But I will explain why it is actually a really beneficial approach and can work in many situations. So first we have to know a little bit about dental caries. And that term caries is not as commonly used term in layman's terms. It's that idea of cavities, decay in the mouth. And surprisingly, it is the most common chronic disease in America and in many countries around the world. So we don't think about that, but there's quite a big epidemic of this particular problem in children and even in adults. Specifically addressing the primary dentition talks about baby teeth, kids, ages 6 to 12 or even older, or from birth and even older. Early childhood caries is more specifically defined as the presence of one or more decayed, missing, or filled tooth surfaces in a primary tooth in a child that's 71 months or younger. So that's addressing kids that are in that 2, 3, 4-year-old range. And that is also a growing problem in America and around the world. There is a lot of early childhood caries. Some things that have been shown to be connected with early childhood caries in various studies are things like poor diets that are high in carbohydrates, sugars, poor oral hygiene, a lack of dental education, low income, and limited access to care. So those are all barriers that we're trying to overcome in addressing this problem, this epidemic of early childhood caries. Now, we'll just turn it off. There we go. There are certain, common treatment options that I'm sure you guys are all familiar with, but it's good to understand a few of these in order to understand why SDF, so Silver Diamine Fluoride, could be beneficial. First of all, we have a filling. There's different kinds of fillings, amalgam fillings, resin-based, composite, tooth-colored fillings, where you excavate all the decayed material and fill it in with a new material. Pretty simple, basic idea, sometimes complex and expensive in its application. SSCs, stainless steel crowns, are a very common treatment option, specifically in kids. And that is because of the temporary nature of the primary dentition. The fact that those teeth eventually are going to exfoliate, are going to be lost. Protect the tooth now so that the teeth in the future aren't affected at all. So SSC, especially with big decay, teeth with lots of decay, it's a very, very good option for just covering the tooth and protecting it for the life of the tooth. Now, a pulpotomy is, if you know the pulp canal, is where the nerve is housed. Pulpotomy is necessary if the decay has reached that nerve layer. Instead of having to do a root canal, like we would do with adults in order to try and save the tooth long term, there's a procedure you can do in children where you put in a medicament that actually clean out all the nerve and put in a medicament that will preserve the life of the tooth, hopefully, until it exfoliates. So it's not quite as extensive as a root canal, but it's necessary at times. And then finally, if there's an abscess, the tooth is infected beyond the point where it's savable, extraction is a treatment option. Also, some important things to understand in considering what treatment is the best in any given situation. We have to think about unique aspects of the primary dentition. And of course, we're dealing with kids, so behavior management is huge. And that can be very difficult when you are performing restorative care, doing a filling, a crown, an extraction that requires using Novocaine, Septicaine, Lidocaine, local anesthetic where there's a needle involved and there's, they have to sit still for a long amount of time, lots of stuff in their mouth. It's very difficult, and it's a huge, huge challenge to overcome when you're trying to use these other treatment options. Also, their temporary nature is important to consider in how we treat, and I've already explained that a little bit with the SSC and different types of restorations. But also there's an increasing trend these days in addressing prevention as opposed to just restoration. So ways that we can actually prevent decay, obviously better oral hygiene, better education, but even specific treatments like a fluoride treatment. That's pretty relatively new. I mean, there's always new things, fluoride varnish that you put on the tooth that helps prevent further decay. And SDF will also have aspects of that in it. So those are some unique aspects of the primary dentition. First of all, I want to talk about how SDF works. And so first, there's two mechanisms. There's a chemical mechanism and a microbiological mechanism. The chemical mechanism is important. The diamine is simply just used as the medium because it's stable, it's colorless, and it's a liquid, right? So the diamine is not doing anything chemically within the tooth or addressing any of the decay. It's just a great medium for delivering the silver diamine fluoride. The fluoride specifically has chemical function in that it prevents demineralization. And that's where the tissue, the demineralized tissue, which is what happens when decay happens, the tissue gets demineralized, it forms a crystalline structure that is actually more resistant to bacterial acid. So I guess to understand that, you have to understand that bacteria on the teeth are eating carbohydrates, their mechanism, cellular respiration, everything releases acid, just like anything acidic, and that breaks down the tooth enamel. When you add fluoride to that hypomineralized, that where there's been demineralization, it remineralizes that top surface, but it does so, and it's actually even stronger than the original. There's these crystals, hypoxyapatite and fluoroapatite, that form, and that results in increased mineral density and hardness. This new material matrix also limits the acidic effects of bacteria as well as the effectiveness of enzyme digestion. So it's just a lot stronger and more resistant to decay. We need to look at the microbiological mechanism of fluoride, and this is where silver comes in. It's very, very important here. We see that fluoride has an antimicrobial effect in that it inhibits the production of acids. These acids that I already explained break down the enamel in the tooth are inhibited by fluoride itself. And then it also inhibits sugar uptake. So fluoride ions can influence enzymes, bacterial enzymes, and they influence enolases and ATPases, which, when influenced by fluoride, inhibit the carbohydrate metabolism and sugar uptake. So obviously, bacteria need sugar and nutrients to survive. If you inhibit those enzymes that are able to uptake those sugars, then the bacteria die. Hence the fact that it's antimicrobial. Now, silver is very important in the antimicrobial effect, and it's related to its interaction with sulfhydryl groups of proteins and DNA in bacteria. And those effects that it has is that it inhibits bacterial respiration, it unwinds DNA, it denatures proteins, it breaks membranes, inhibits cell wall synthesis, and inhibits cell division. Those are all really important pathways that silver ions actually mess up within the bacterial reproduction and everything. Also, silver ions are bactericidal metal cations that inactivate the glycosyltransferase, which has an adverse effect on bacterial synthesis of polysaccharides. Now that was a mouthful, right? What it is that there's this is what I'm talking about, biofilm reduction. So we know that we all have a biofilm on our tooth. Well, a major aspect of the biofilm is adhesion. The cell wall is adhesion to the tooth itself. And so if you're inhibiting that glucose, that uptake of those sugars, then the adhesion is also inhibited, and not as much bacteria is going to stick. Does that make sense? On top of that, this is really cool, there's this thing called the zombie effect, and there's a resistance to biofilm formation, but on top of that, the silver ions have all these negative effects, and they kill the bacteria. And then the dead bacteria mix with the live bacteria, and when those dead bacteria mix with the live bacteria, there's almost this zombie effect where they reactivate those silver ions to kill more live bacteria. So it's a positive feedback loop known as the zombie effect, because they're like zombies attacking the live bacteria. Okay, so now we know a little bit about how it works. We need to address the data on whether or not it is effective, if it's effective in killing bacteria and inhibiting their processes. And here we have a little bit of information here. A study took 3, actually 5, but they only listed 3 here, different strains of bacteria, and they did it in vitro, in an artificial mouth, actually, but the mouth is actually replicates the same environment of a real mouth. And so they analyzed these 3 very important or very common bacteria, even though there's like 700, but this is a really good representation of a few really important ones, like Streptococcus mutans are important pathogens involved in the initiation of caries. So they start that process, and then other ones might come along. Other strains are listed as are most abundant, like the other 2 here, in carious lesions where the pH is already acidic. So once it's already down that pathway and the acid's being produced, these bacteria thrive. So they're really important in producing caries. And you can see here that this is the test where they had silver diamine fluoride and the control. And this was after 7 days of application. You can see that the bacteria count was up to 0.65 plus or minus to 0.71, and in the control it was already up to 8.66. So there's a huge difference there. And then if you go further into day 14, you can see there's some bacteria, right? Some total bacteria here, but the control has twice as much, so it's gotten even more. And then if you keep moving down at the end of day 21, there's still only 5.72 here, but 12.2. So it definitely inhibited bacterial growth. And you can see that trend is the same in all of them, obviously with differing exact results, but the total bacteria is the most clear. So, how do we apply this clinically? How does it work? I'm sure you guys are wondering that. I haven't explained how to actually use this particular treatment. Well, first of all, you identify the affected area as you would normally, observing it, sometimes using a probe or an explorer and seeing if the tissue's soft. Sometimes you can just see it looks decayed. Then you have to isolate it and dry it. Isolating just means using something to keep it dry, like a cotton roll or gauze or something. And then use a little microbrush, a dapping dish, apply a thin layer of SDF to the lesion, specifically where it is. The lesion is the cavity. Allow it to dry for 1 minute, rinse. Seal with fluoride varnish, that's optional. It's kind of an added benefit because fluoride's always good. And then repeat periodically until caries arrests. It's that simple. No needle, no anesthesia, not a lot in your mouth. It takes a minute, 2 minutes. So it's really, really easy, surprisingly. This last point, repeating it periodically, that is one area where there's a lot of differing ideas as to the best approach. Some people do it by every 6 months. Some people do it yearly. Some people do it even more often. And that's something that there's continued study going on as to find out what the best is. I'll talk about some of right here. Efficacy. Does SDF work? Right? We saw it work in vitro, in vitro, but we need to see if it works with real patients. So here is there's 2 studies here where they took the DMFs of a sample of children. Now you're probably wondering what a DMF is. DMF is the decayed, missing, and filled teeth index. So it's basically a way to determine the amount of decay in a child's mouth, in someone's mouth. They count up, okay, how many decayed teeth do they have? How many do they have missing? How many of them are filled? And they come up with this particular index using a formula. Okay, so they did that. So they took 225 children here, 227 with similar DMFs. So they have similar problems going on in their mouth. When they applied SDF, there was 3 active caries surfaces, so 3 places where there was decay. And after, obviously they lost a few school children after 36 months of application, but still these same ones, you can see that the DMF of the ones that had SDF is about the same, and the DMF of the control has stayed about the same as well. And then if you look down here, we can see if you do SDF with 180 here and 193 here, there's barely any new surfaces with active caries, and here there's a little bit more in the control. And then with inactive caries, right here, those are, remember they started with 3, now there's only 2.8. There's 2.8 inactive caries. Okay, so those caries, there was about 3. Well, almost all of them are now inactive. Whereas with the control, some of them will just heal on their own or be inactivated, but not all of them. So you can see that after the SDF is applied, there is evidence to show that it stops any more decay from happening. Obviously, there's some, but the majority, it does well. Now, we can see that you have this idea of the black stain. I'm going to talk about what that is addressing. 97% had black stain, 48% in the control did not. I'm going to explain that coming up here. But here's a review of the data, a little bit another graph, with 6 different studies. So this has been a pretty big topic, as you can see, from 2000 to 2014. You can see here that the control, 50%, well, this is a graphic summary of randomized controlled trials demonstrating caries arrest after treatment with 38% SDF. And the caries arrest in the control was about 50%. If you did SDF every 6 months, Q6 months means every 6 months, it almost arrested 100% of the caries in this study. In this study, there's this glass ionomer cement, which is just a different treatment option. They're comparing the two. They have it with application each 1 year, and then with application every 6 months. And you can see that it goes up, and that there is well over 50%, almost probably about 90% of the caries were arrested. And you can see that trend going all throughout. Even this one's really showing it all. The control, there's nothing that was inactivated, but if you added the SDF, it was about 50% were deactive, were no longer active caries. So, is this a good treatment option? Is this what we should do? Well, we have to consider the positives and negatives. The positives, we know that it's effective. We know it's effective, and I just explained that. We know one thing that's very beneficial about it is that it's affordable. You use just a little bit, and compared to other treatment options where you use many different expensive materials, it's way better. I discussed how you put it on. It's easy to use, which is really important in treating children. You can do it without having too much invasive procedures done. And then it's also not very toxic. It has very little toxicity. Some negatives, well, first of all, you see right here, and you saw in the first couple slides, and I addressed it earlier, it stains the tooth black. So you might think, oh, that's probably the decayed surface, but no, this is decay. This is after it's been treated with silver diamine fluoride. So obviously that's a big negative, and that's something you really have to consider. Some people might, if it's on the back of the tooth, sure, go ahead, we'll stain it black, you can see it. Some people might not like the negative aesthetic effects it'll have on their kid. So you really have to address that, and it's an unfortunate side effect. And there are studies, there isn't anything right now, but there are studies being done to see if that can be hindered or, try and make it so that it doesn't stain black. You can also, after, if the parent or they don't like it stained black, you can add a filling material to it to cover it up. But yeah, and then the other thing is some patients complain that it tastes a little metallic when you put it in, especially if you get it on a little bit on the soft tissue or on the tongue. Obviously no toxic effects, it's just a little bit of a minor taste that goes away pretty quick. So what's really important in the application of this, I addressed this a little bit, is communication. You gotta communicate with parents. And so this is a form right here that I found that really does a good job of explaining everything that SDF will do, the positives and negative effects, the benefits, even showing what it might look like, and then having the parent sign, because that's in clinical application, that's huge, because you want the parent to know what's going to happen. If you don't explain that it's going to stain the tooth black, they're not going to be happy. But then there's the alternative option, more expensive, doing a resin filling where you have to use a local anesthetic. Sometimes if the kid's too young, you have to take them into the hospital, into the operating room, and put them under, and that's dangerous, has its own negative effects. So you have to explain both sides very clearly so that people can make the decision for themselves. And it's pretty exciting, the prospects of this treatment in the future. And I'll address some of that here. ART, alternative approach, it's atraumatic restorative treatment. Is a it's a newer trend. It's a way that a lot of people are approaching it. In the past, people have just said, well, just make the kid get it done. But that might have long-standing effects on the kid's psychology, on their growth and development. And so there's a push for this atraumatic restorative treatment, and Silver Diamine Fluoride fits right in to that approach because it doesn't require any invasive techniques. It has a huge application in public health. If you remember when I said that, talked about early childhood caries and how it's one of the most abundant chronic diseases that we face. And I listed off why it was, what were some of the things that have been proven and shown to be linked with it. It's lack of access to care. It's poorer income families, people that aren't able to make it to the dentist, people who don't have good diet or good hygiene. And so those are people that public health is really, really focusing on. But the problem is public health doesn't have endless funds. It's expensive. It's expensive to go into a school, set up a clinic and bring people in. That requires a lot of planning, organizing, and money. With Silver Diamine Fluoride, that doesn't require nearly as much. The training, you don't have to be trained, you don't have to be a dentist to apply this. Hygienists can do it, which is huge. And so you can go into a school and arrest all kinds of decay with using a product that's not expensive with very minimal overhead. So that's huge, not just here, but also around the world. In fact, China is using it way more than we are. They're way ahead of the game. And some other countries too, underdeveloped countries, where before you'd have to go in and may not have food, may not have running water, or may not have a facility with electricity. So what do? Then you just extract teeth, right? But now, instead of having to go that route, we can apply Silver Diamine Fluoride, and it might actually preserve those teeth until they come out. So what are some next steps? Some next steps are compensation for dentists. Of course, the insurance companies are involved there, and for a dentist to want to be motivated to do it, they need to be compensated. That's just the way it is. And there is, right now actually working in an office, there's a code that we can use. It's legal to use that code so that the insurance companies would reimburse, but it's not specifically for Silver Diamine Fluoride. And so I was just recently at Pediatric Dental Convention, and that was one thing they were talking about. People that were presenting to me were like, hey, we're in Washington right now working on laws and figuring all this out. So that's one next step. Education, I already addressed the importance of that, helping parents know exactly what it is and how much it can benefit us. And then just letting people know in general how this could affect public health and missions around the world. And then mobilization, of course, applying it by actually bringing it into schools. and actually bringing it across these or wherever there is need, because it's still somewhat low key. It still isn't like a big thing, but there's no reason to believe that it won't be. It's not going away anytime soon. It's definitely going to be something you'll see in the future. Who knows, with your kids even considering it. So that is all. Questions? We doing questions?
Okay. Yeah, let me just turn this off. Yeah, okay. So you should like off the camera now, so.
Okay.
Yeah, questions?
Yeah.
Now you said you could apply something to cover it up for a cosmetic effect.
Yeah.
How expensive is that, or how easy is that to do?
Right. Yeah. So it depends on the particular situation.
Right.
If you need to numb or go through all of that, then it requires a dentist to be able to do that. It gets more expensive. It's almost just the same thing as just restoring it in the first place. You know what I mean? But then you just don't have to do any drilling or excavating.
Right. Whereas adults, they could get that treatment if, as kids they have seeing teeth, but
and then they
decide to later
yeah.
cover it up.
Yeah, you could do that. I mean, typically there has been application of SDF. I focused it on baby teeth, but it's been used on permanent teeth too. You'd want to try and avoid that as much as you can,
Right.
because you have those teeth forever. But yeah, if somebody used it, maybe you had a cavity on your 6-year molar,
Right.
and the kid was not going to behave, and you said, yeah, sure, let's put some Silver Diamine Fluoride on there, and then once they're older, you can just finish it. It gives you time, which is really nice. Yeah.
So I have like 2 questions, I guess. Is that black stain permanent?
Mm-hmm.
Is that just because the metal's getting oxidized in the mouth constantly?
Yeah, it's the silver reacting. It's the silver reacting with.
So
Yeah.
Do you know if there's anything to you can unoxidize a metal, you just add like a catalyst that would reverse that.
Right.
So do you know if there's any research in having that so it doesn't stain the teeth?
There is research,
Yeah.
but it's in its infanile stages. Yeah, it's seriously
So I'm sure you could just add something to that metal.
It seems like it.
So you could just.
But like I said, this is such a new thing. That's kind of
Yeah.
been an afterthought that people are now
But
looking at.
the thing is that I was thinking this too. This
Yeah.
is just to follow up on that question, which is a really good one. I'm not sure if you did that, if it would still be as antimicrobial.
That's what
That
I was
was the
asking,
other
if
thing,
the other,
yeah.
if it still has a.
I'm guessing that's why they wouldn't have just done that,
Yeah,
because
right.
it probably.
I'm sure they just haven't found what.
And if
would
it
do
is
both.
just
Yeah.
used for baby teeth,
Yeah.
at that point.
Yeah.
But I was thinking if
If
you
you're
used it for,
Permanent teeth, yeah.
which sounds like it would be a good treatment.
It's a good-
especially
yeah.
in third world countries to use.
Yeah.
That's what
permanent
I-
teeth.
It's a huge, that's where it's the biggest applications. Yeah. She does.
I read that fluoride, well, my brother, he used fluoride and he has very sensitive teeth and it turned his teeth black. So
Turn black.
I read that can actually happen when people have sensitive teeth. So do you think that maybe that could also have an effect on turning it black when
The fluoride could?
yeah.
I don't think so.
Mm.
I'm surprised to hear that, because there is such a thing as fluorosis,
Mm-hmm.
where you have white spots on your teeth if you got too much fluoride when they were developing. I've never heard of anything where it would turn your teeth black.
Hmm.
So either I might be ignorant about if that particular thing. I do know that fluoride can have an effect, but not that particular one. Maybe they put Silver Diamine Fluoride on it.
Maybe.
So, I've been thinking about this a lot, in part because, as you know, last week I was traveling south. So,
Yeah.
on our trip, we traveled through some parts of the country that are a lot poorer. Because we certainly have many places in the U.S. where the economic situation is the same as what we call third world countries, right? So I saw a lot of people with no teeth. So something like this could be really transformative.
It can be.
For children and adults. And as you wrote in your paper, there are really severe health effects to having
Yeah, I
poor
didn't mention
dental
that.
health.
Somehow I skipped
But you
over that.
can't fit everything in. You can't.
Yeah.
I mean, but you wrote about
I
that.
did, yeah.
But the thing that I got thinking about is, I think it's going to be interesting as this rolls out, which I think it will. There will be a stigma because of the color.
I think so. Yeah.
I mean, there's already a stigma with having no teeth in poverty, right?
Or kids, poor kids that have silver teeth.
That's what I was
Yeah.
thinking, like the downfall of it's gonna be, is this just gonna be like another, I don't know how to describe it.
A
Like,
marker.
Identifier.
Yeah. Like, and with baby teeth, it's one thing. It's kind of like, it's easy for us to kind of wave our hands at that, but.
Because they're kids, you know, like they're wanting
Yeah.
all the candy.
And we're practical people, we're scientists, so we're like, well, their teeth are gonna fall out, they're gonna get new teeth, it's fine.
But a lot of people don't think that.
No,
No.
So it's kind
The
of
majority of people.
yeah,
don't
it's
think
gonna be really interesting to see how this all plays out.
like
Yeah.
on the negative side, you can see someone being like, oh, so because we can't afford to get this.
Yeah, I
this
can't
is
afford
what
the
we're-
weight
Now I
filling
have
for my
to have
child.
Yeah.
Right. So it kind of increases that cost.
That's what I was trying to do.
No, but I love it from the point of view of health, right? Like you could get, you could be an adult that still has your teeth, right? And that literally will allow you to live longer,
Yeah.
right?
It
And not
increases
have heart
quality of life
attacks
in a lot of
and,
ways.
you know,
Yeah.
a stroke at the same
Yeah.
rate. But it's just fascinating to think about. There's gonna be some really interesting tension around this, I think. But,
Do you have like a dollar amount of how much this costs, like if somebody didn't have health insurance?
great question.
Because
That's a
it
good
seems so
question.
easy, like I could do it. Like, you know what I mean? Like just give me the stuff, I'll just swipe it on your teeth.
Yeah, I want to say. I mean, I've seen what we charge at the office I work at, and I want to say it's between $30 and $50.
That's
Wow.
compared to like like the white tooth.
Like a white filling can be 150,
That's what I was just
200.
saying,
Yeah.
Yeah.
A stainless steel crown 250.
That's
Yeah.
Right.
That makes dental care possible for a significant group of people who otherwise would not be able to
Right.
do it.
Well, one thing I talked about compensation. You know, a lot of the world revolves around money, and so
We talked about this just
so dentists are thinking, well, do I want to have this
How?
treatment in
Right,
my
yeah.
office because I'll be losing money.
Yeah.
So that's why, and that's a valid. That's valid. Like they're making
Yeah.
a living off of that. That's why insurance companies need to incentivize it. That's why that's so important in the future. That was a huge thing. Like they had a question and answer time at the convention that I went to, and that was dentists kept asking questions surrounding that. Like how do we get compensated? Like this is great for missions when you're wanting to help people out, but when you're trying to make a living, you know, you can't always go back to that. Yeah.
Right.
So it's interesting.
If this was like a normal practice, like a silver cavity filling or what have you, how much would like the dentist's salary pay go down? You know, because instead of like $200, we're looking at $30. You know, and like can you imagine how many cavities dentists do a day? Probably a lot. Like, you know, so because you
So it
check,
will
they
lower-
check,
yeah.
check every time.
Exactly. And then, you know, some people say, tough, dentists have it easy anyway, so who cares about the dentist? You know what I mean? They make a lot of money. So then it gets into this whole, it can be even political, you know.
Well, I think this
side of
relates to the
things.
fact that the way dental health is handled is, it's oddly outside of
Of
the
medical.
rest of our physical
Yeah.
lives.
Which is also a trend,
I
there's a
hear
trend
it's the same.
changing in that too, yeah.
Yeah, it should really be your body,
Right.
right, is covered under your health insurance.
Your whole
It's so
body.
interesting that it's separate, yeah,
Because you guys are expensive.
right.
You're
I
expensive.
think,
expensive.
I think there's some history to it, because it's the same in,
There's a lot of cosmetics versus
That's true,
health, so
too.
I feel like, but I don't know if that.
Like you don't need that tooth, just rip it out. Who cares?
I think it's,
Well, I was just talking to a dentist the other day, who was like, they don't really study, in medical school, they don't study the dental side of things, which is bad, because it's part of your body. Dentists have to study, you know what I mean? We should have to learn everything about the body too, you know? That's why it should be more connected.
And it would have
anyways.
such an impact on your health.
That's what I'm saying, like your mouth stuff, yeah.
Yeah.
You had a question?
Yeah, so just thinking, like it said, you could get it like touched up every 6 months or
Yeah.
so.
Mhm.
So if that was the case, going back to like the money thing, so does that mean you would have to repay
I think so,
$60?
yeah.
So in the, depending on the longevity of the
Sure.
treatment and the affordability, you could think long term, whereas you don't have to have the other treatments replaced.
Well, yeah.
Sometimes,
Those,
but yeah, that,
But more than likely, you're not going to.
Right.
So that investment
Good point.
versus,
Right.
you know, the follow-up
but in
investment.
pediatric dentistry, it might, the math would be different, right?
Yeah.
Because if you just gotta make it long enough for the tooth to fall out,
Right.
like, that's a really great
Depends on
point in
age,
the
I
cost
guess, of the
analysis.
person.
Yeah, it complicates things.
yeah, I mean, it does have a positive effect if you just do it once.
Right.
that was proven on that, that's been proven in many studies. They just say it might be better when we do it. Maybe dentists are doing that for a reason, to be able to.
Well, that's what you're
It
saying,
is
it's
compensation.
subjective, so I
Yeah.
was just thinking depending on the patient, or like
Yeah.
if they were gonna offer it, they might be like, you need to follow up every 6 months.
Right?
You know, they can implement that kind of policy
Mhm.
based on their treatment protocol, so
Yeah.
it's just.
And that can be difficult when you're dealing with public health. People, Medicaid patients, that population is more inclined to not show up, to just stop coming. And so then, Silver Diamine Fluoride, you put it on once, well, you need to do it again. That needs to be kind of a requirement. Yeah.
It's a really interesting thing to check out.
Very interesting. Yeah.
Maybe I missed, did you say any dentist here, the dental office you work with, does that?
Yeah.
So if, say, even an adult wanted to get something, a cheaper option done, and they're not as concerned about the cosmetics, could they request something like that? Cause,
That's a good question.
I doubt that
Could we
the,
all ask for it?
yeah, like if you want that, could you go and get it? Or, and
That's
it's
a good
also
question.
for
Yeah,
other.
like
Probably.
if I have a cavity in the back of my mouth,
You're like,
I really
yeah,
don't care
but that's
about.
Silver.
Or for someone
Yeah.
in their 60s who's really just concerned about their health,
Health,
not so
no.
much concerned. And I hate to, age stereotype, but I'm
Yeah.
thinking of my
But,
parents.
well, at different ages, you have different,
Good point.
expectations
Yeah.
and
Different-
priorities for
yeah,
your
priorities.
teeth and mouth.
And they may not care about having, even on the front of their teeth, black.
yeah, so, a couple answers to that. I don't know if all the general dentists have it in their office.
Right.
I don't think mine does.
Yeah, most of them don't. Some of them do because general dentists don't like dealing with kids, so if they can just slap some stuff on there, then they're happy about that.
Right.
But the other thing I was going to say is I was researching more specifically baby teeth.
Mhm.
I think there might be a little bit less of an effect on
I see.
adult teeth.
Oh,
Gotcha.
the teeth are different?
Yeah,
Well,
teeth
yeah,
are different
supposition,
from baby
okay.
teeth to adult teeth.
Huh.
And so I think if they're more recently erupted, the
I see.
the enamel's a little bit less mature, and the more mature the enamel, the
Lesser section.
less it would, yeah. And I haven't researched that. That's just an idea that I haven't really studied that.
Okay.
Okay, well, very good.
Thank you.